Hello, AHS 110, Section 2. My name is Walter.
I'm Kevin. I'm Josh.
And today we'll be discussing the main features of the Comprehensive Healthcare Reform Law of 2010. And to start us off will be Josh.
Today I'm going to be talking about the main characteristics of the Reform Act. The first one is the length of coverage. It allows younger adults to be covered by their parents' insurance policy up to the age of 26. The second one is coverages will now cover people with pre-existing conditions. The third is ceilings on insurance coverage. It ends lifetime ceilings on the costs of healthcare. Number 4 is major Medicaid expansion is called for in legislation. Each state can now decide whether they want to do it. So the Supreme Court ruled that each state has to expand their Medicaid, and now each state can choose whether to do so if they like to. The Medicaid benefits are now increasing. It guarantees the benefits of previous years, but now they are allowing free preventive care for immunizations, mammograms, and colonoscopies. Number 6, the cost of prescription medication is going to be decreasing throughout the years and hopefully be eliminated by the year 2020. Number 7, employer coverage. You can choose to keep your coverage from your employer, or you can choose to find a new coverage through your state insurance exchange, which number 8 is about access to health insurance exchange. You can buy coverage through state insurance or exchange, which is online markets that companies compete for consumers. And number 9, individuals must have health insurance. Most taxpayers without insurance by March 31st, 2014 will have to pay special taxes on their annual returns, and every state will expand Medicaid programs to low-income family members and family members less than age 86 or 85. And then the final one is Medicaid payments to hospitals and health insurance companies. Payments will decrease if patients have multiple returns to the hospital within a 30-day period. Insurance companies must use the premiums they receive to help patients rather than admission costs. And the last part of that is high-income taxpayers who make more than $200,000 a person or $250,000 a couple will pay more for Medicare hospital insurance taxes. Yeah.
All right, so I'll be discussing the pros and cons of the reform laws, and basically I have 10 points of pros, and then we'll just go over some cons and then move on. So the first point, the reform laws prohibits pre-existing condition exclusions for children in all new plans. So children sick prior to the plan, they will be covered now and be able to get treatment. And point number 2, they will provide immediate access to insurance for the uninsured Americans who were uninsured due to a pre-existing condition beforehand. So point 3, it will be prohibiting dropping people from coverage when they get sick in all individual plans. And point 4, this will lower senior citizens' prescription drug prices. Beforehand, low-price drugs and high-price drugs were covered, but they described it as a donut hole in between the prices where they weren't covering the prices in between. So now all the prices, the entire price range will be covered. Point 5, they will offer, or tax credits will be offered to small businesses to purchase coverage, and the small businesses will get tax credits to give more insurance to their employees. And in point 6, this will eliminate lifetime limits to restrict annual limits in all plans. And point 7 will require plans to cover enrollees and dependent children until age 26. And point 8, it will require new plans to cover preventative services such as immunizations without cost of care. So this will encourage people to go get checkups more often. And point 9, this will ensure consumers to have access to effective internal and external appeal process to appeal new insurance decisions. So if your insurance company decides to deny something of yours, you have access to appeal it. And number 10, it will require premium rebates to enrollees from insurance with high administrative expenditures and require public disclosure of the percent of premiums applied to overhead costs. So we'll just go over some cons here. Basically, the reform laws are not regulating the insurance companies, and in the end, the insurance companies are still trying to make a profit off you. So there's nothing against raising your premium. So premiums will be raised. Also, the public option is going to be cut down, so hospital prices are going to increase. Pharmaceutical companies also still have the patents on the drugs, so there's no really regulation on that, and nobody can really compete with the pharmaceutical companies. And there'll also be an increased tax on incomes to make up for these prices and the premiums. So it's about pros and cons, and lead on to Kevin here.
Just to go a little bit more in depth and some recommendations that we have. The reform law has indeed helped millions and millions of Americans, but there are some gray areas that are still left untouched where the reform misses. Debate always seems to come down to there's always trade-offs for each and every piece of legislation that goes through, and I'm not really sure how you can put a price on a human body and how that these markets are still competitively acting on each other and still making profit off each other. That is where America's reform law needs its most work. They shouldn't be out to be making a dollar off everybody. If we really wanted this reform law to go through and to act as all these other countries do, like we watched the movie They Sick Around the World, like Taiwan and France and Great Britain and Germany, there are healthcares out there that work and that are successful, and that there are people in Taiwan, there's nobody that are going bankrupt due to family illnesses. And in Great Britain, there's no families that are going bankrupt to family illnesses. In America, millions. And it's just sad that that's how it comes down to. And there's a weird correlation that some people are trying to connect between the mental illness part, and it's due to Americans unable to pay for their daily expenses. And so it's just like a big circle. They can't do this, so they're going out and becoming obese. They're not exercising. They're not doing this. So they're even more and more in debt to the healthcare reforms. And let's see. Citizens strive for lifelong happiness, and that's what the ultimate goal should be. And the best way to combat this problem would be like what we heard in those videos. Just go around the world, survey all the countries that are successful with their healthcare, generate a new one, mold it together, and there's not a pinpoint definition where this will work for us. But it's just taking everybody else together and putting it into a new one. And then we could start from there.
All right, thank you guys for listening to our presentation.